Hi, I'm Dr. Wilfredo S. Tagle, a urologist. I'm a lifetime member of the Quezon City Medical Society, a lifetime member of Philippine Medical Association. I have served as Governor, Quezon City Region for PMA, and past President of Philippine Urological Association, Philippine Academy of Medical Specialists. Welcome to our program. For today, I will be talking about the problems of the urinary stones. Urinary stones have been a problem of mankind ever since even in the Egyptian prehistoric era. The earliest was in Egypt and Al-Hadra. In the Philippines, there are a lot of people who are affected by urinary stones. It's around 2.3% of the whole population have urinary stones. 12% of those are males and 6.5% of the total population are females. Even if you treat urinary stones, it is around 50% will have a recurrence after a year. Then around 50% of those who've been treated with urinary stone will have a recurrence after 5 years, and 80% will have a recurrence after 10 years. That's why they said that once a stone former, always a stone former. So we really have to treat and prevent the recurrence of stone formation. Urinary stones are usually formed by the concentration of the food that we take in and the water that we take. It's just an imbalance between the food that we take and the water that we drink. If there are a lot of foods that have a lot of crystals, will be deposited in our urinary system, and on the other side, if the water or fluids that we drink are few, there will be crystallization and stone formation. Of course, other factors are like urine pH, which is the formation of stone, is just a summation of the urine pH, crystallization, and its time. If those three factors have been combined, there will be a stone formation. Regarding the urine pH, usually there will be an acidic urine and alkaline urine. For urine pH 5.5 and below, the common stones that are formed are the cystine stones and the uric acid stones. On the other side, for alkaline urine, for pH 6.2 and above, they will form the calcium stones, the phosphate stones, and the strobite stones. While for normal pH between 6.5 and 6.2 pH of urine, usually the stones that are formed are the calcium oxalate stones. Here in the Philippines, there is a study by Dr. De Luna wherein they examined all the stones that are removed from their patients, and they found out that 46.85% of those stones are due to calcium stones. Then 20.72% of pure stones are due to uric acid stones. And on the other side, mixed stones, combination of uric acid and calcium stones, are around 32.4%. What are the clinical manifestations of patients with urinary stone? Number one, the most common is pain. Either it's on the back pain, it's on the flank pain, or hypogastric pain. Number 2 is bloody urine or hematuria. It could be a gross hematuria wherein you can see it through your naked eye, or a microscopic hematuria. Number 3, usually there's a urinary tract infection or even just a pyuria seen in your urine analysis. Number 4, passage of stones or even sandy materials. Then, number 5, signs of obstructions or intermittent urination, wherein the stone will block the urinary tract. How do you examine the patients with suspected stones? Number 1, urine analysis. You have to know the pH of the urine of the patient. It's either alkaline, acidic, or normal urine. When you say acidic urine, it's 5.5 pH and below. When you see alkaline urine, it's 6.2 pH and above. While those in between are the neutral pH urine. For other diagnostic evaluation, we can use kidney, ureter, bladder ultrasound. And nowadays, we have to have CT stonogram, wherein we can find stones which are non-obstructing and even they are located at the ureters. Once we have diagnosed renal stone, there are a lot of modalities for treatment. Number 1, you can just have a conservative management wherein you just give a lot of water and hoping that the stones will be expelled. Number 2, we could give medical management. And number 3, surgical management. For surgical management, there are a lot of conditions before you can do or offer to your patient surgical management. Number 1, if there are signs of obstruction, wherein you will destroy the renal function later on. Number 2 is the persistent infection. Even if you give medications or antibiotics, still the patient would have recurrent urinary tract infection. Number 3, persistent bleeding, recurrent bleeding, either it is gross hematuria or microscopic hematuria. And number 4, of course, pain. Usually the pain of a renal colic is the most severe pain that you can have. So that is the most frequent indication for surgical management or for treatment of renal stone in general. We have different kinds of surgical management. Number 1 is the non-invasive. Number 2, the minimally invasive. And number 3, the open surgery. For the non-invasive, usually we give ESWL or extracorporeal shockwave lithotripsy. This is the machine for that, wherein only sound waves penetrates the body of our patient, and on certain focal point, the stone will break. And later on, the patient will just urinate the sandy materials, which are the broken particles of the stone. For the minimally invasive stone surgery, we have the laparoscopy, wherein you insert the instrument through your abdomen in a small incisions. Number 2 is the percutaneous nephrolithotomy, or you insert through your flank area, direct to your kidneys, and remove the stones inside your kidney. And number 3, the intrarenal removal of stones, wherein you insert the instrument through the urinary tract from the outside, going inside and you go up retrogradely, then you remove the stone. For the medical management of stones, we have a lot of possibilities. Number one, diuretics. Sambong, furosemide, buhok na mais, or nilagang ugat ng kugon. They are all diuretics, which tends to flush out the stone, the small stones in your urinary tract. Number two are the stone expulsion treatment, like the terpenes, the calcium channel blockers, the muscle relaxants, wherein you relaxes the urinary tract and hopefully the stone will be expelled. And one of the modalities for the medical management of stone is stone dissolution, like citrates, the potassium citrate, the sodium citrates, then the terpenes, sodium bicarbonate. We have new medications like the lead control, wherein you manage the pH of the urine. It's either you bring them up or bring them down. For the alkaline urine, you bring them up for the acidic urine, and there are also medications for the neutral pH urine. So, if you have a urinary stone problems, you are free to come here and visit us. Just look for your friendly urologist at the Urology Center, World City Medical Center. And remember, once you have renal stone, always you will have a recurrence of renal stone. So visit us here. Come on.